we'll go on to the last, but most certainly not least in terms of the topics that we deal with as people with energy and living disabilities every day, and that is the personal life and your home life. So I'm so pleased to bring to you two amazing speakers from two exceptional backgrounds. I have Amy Mooney, who is an occupational therapist in private practice, specializing in therapeutic care for individuals with chronic conditions involving post-exertional malaise or post-exertion symptom exacerbation. That's PEM or PESE. Amy's pacing guide for PEM guidelines and therapeutic protocol have been featured in presentations at national and international conferences, in her continuing education programs for medical professionals, and patient advocacy webinars. As a caregiver for a loved one in the ME/CFS, Amy understands firsthand the challenges individuals and families experience seeking appropriate care. Amy has a bachelor's degree from Loyola University Chicago and a master's degree in occupational therapy from Rush University Chicago. She is a returned Peace Corps officer who calls Chicago home. And also joining us is Dr. Sharon Stevenson, who has a DVM, PhD, and MBA, who has been working on with the National Hospice and Palliative Care Organization since 2020, and has led the redevelopment and launch of Caring Info website. That's www.caringinfo.org. Sharon is a board-certified patient advocate with a particular interest in serious illness and end-of-life care. She is also the managing director of Acopi Venture Capital, which is co-founded in 2005, and responsible for the firm's life sciences investments. Sharon has received a certificate in patient advocacy from the UCLA Extension, an MBA from UCLA Anderson Graduate School of Management, a PhD in comparative pathology from UC Davis, and a Master of Science in veterinary pathology and a Doctor of Veterinary Medicine from the Ohio State University. Sharon and Amy, welcome so much. The floor is yours.
Thank you so much. I am really honored to be in this on this panel, and I really appreciate your all of the advocacy that Solve ME has been doing this week. So thank you very much. You're right. I've seen a lot of questions come up in the chat of what do we do about it? What does it mean? You tell us that we need to pace, we need to guard our spoons. This is really, it's really a hard thing to do. And I think that's the hardest part about understanding how to live with this disease, is that understanding that pacing is not the same for everybody. And so as a healthcare provider, I have been trained, and I really understand what it looks like to pace and to have a person come through with a medical condition that fits the box. I mean, you know exactly what you need to do. You put them through the run of the mill from a rehab center, rehab program. And they, after a certain amount of time, start showing improvement. And what's so frustrating is that people with ME try and they don't get the outcomes that everybody is expecting. And so it frustrates the provider and it frustrates the individual with the disease. I mean, it is really hard because people start blaming themselves for not being able to handle the situation. And I experienced this watching my loved one go through this and putting that blame back on themselves. And I tried to figure out, what is it that, how is it being misinterpreted? What is happening? How is the therapist not understanding? How is my loved one not expressing their needs? And I finally realized it's not the problem of understanding pacing. Actually, pacing doesn't meet the needs of this individual. And so I kind of went back to my drawing board and tried to figure out what is different about pacing for a person with just a general rehab issue, and what is pacing for a person that has a dysfunctional metabolic issue. And I think this is one of the key issues on why a lot of studies go wrong and patients get so frustrated. I mean, we see that the NIH is putting in a whole bunch of money, and some of the tests or some of the research is not pointing specifically to the issues that the people in the ME community and the long COVID community are yelling about. We're saying this needs to target the actual PEM. This needs to target post-exertional malaise. And I believe that the issue comes to be that the goal outcome is on the activity and it's not on the recovery. And so I would like to present to you guys some of my slides just to show you what that means to me and why I needed to kind of refocus and reassess what pacing for PEM truly looks like. So let me share my screen briefly, and I will hopefully be able to give you a little bit more information. So what I've come up with is that pacing is a strategy we use for managing exertion over time. And I've broken it down into 3 categories of pacing. One being pacing for individuals without significant health concerns. It's for when you're healthy and you're just maybe have a child and you haven't slept for a week. It's for an individual who maybe wants to go for a run but has to do work. And so it's just pacing your life for your exertion with a healthy body. And then we look at pacing for therapeutic strategy. And this is where I think a lot of the rehab centers, this is where they're stuck and they think that this is what pacing means. It's for somebody that has an intact metabolic system. They might need specific training on how to get through exertion with a new hip, or somebody that has had a stroke, or somebody that has some sort of brain injury. This is something that can be taught and replicated, and then the person goes on to live their life with this new strategy. But pacing for PEM is for individuals that have a broken metabolic system, and it is a complex system or way to look at how to pace. And it's for a disease of metabolic functioning. It's complex, it's specialized, and it's absolutely vital for managing tasks, exertion, and the recovery over time. And pacing for PEM, it must account for the exertion that is prior to the task, during the task, and also for post-task recovery. And pacing for PEM is a lifestyle. And it is a lifestyle for symptom management. So, let's see if I can. And this is what it looks like if we break it down. Pacing for PEM is first looking at the task analysis. And this is what OTs really get into. This is kind of our fun part of our job, is we look at tasks. And we look at what is it that you really must do, you might want to do, and you may do. What's your wish list? So your tasks are prioritizing your list. I really need to eat, and I really need to use the restroom or be able to some sort of toileting. I might take a shower. I might wash my hair. I might answer these emails. I may talk to a friend, or I may get my groceries. So those are the things that you need to start prioritizing. What's the to-do list? And then the activity analysis is the plan. What is it going to take with the energy that you have to get this task done? And how long is my energy envelope going to last? So those are the kind of the components that look at the task as a whole, and then finally looking at the adaptations and the modifications that are needed to be able to support the activities. And this is where some help is needed, because you don't know what tools are out there. OTs and physical therapists can also get into this topic, but this isn't necessarily what they're really trained to engage in, but OTs are. And that's where finding a good OT is important, but not vital that this therapist needs to know everything about the disease itself. As long as you find somebody that is open to learning and understanding your condition as a whole, this is where I think you can get a little bit of help, because there are not therapists that are trained in ME or long COVID with PEM. But if you find somebody that is open to learn, they can start visualizing what your support is needed. And then also looking at generally, what are the stressors of your activity? Because not every activity is going to be a low intensity stressor. Being at home in your room or in a quiet, restful place, you can control what the lights are like, what your sounds are like, your smells, your touch, all of the sensory components. But when you are maybe at the grocery store, it's harder to control. So understanding what the stressors are for the task or the activity can help you prepare for making the decisions of what your energy envelope has in store for or in stock for you to be able to use or expend. So looking at what kind of sensory activity stressors are going to be involved through sensory, cognitive, physical, and social emotional. So just briefly, those are some of the stressors that I think that you can start looking at for each task that is going to be on your to-do list. And then looking at the activity analysis is, what is it going to take to get this task done? What's the time involved? Is doing something in the middle of the day better than in the evening? Or is something that I can do every other day or every other week? Just timing out when you can perform a certain task gives you a little bit more control over when you make your choices, because that's what it all comes down to. Is once you have more choice in your life, you start building quality of life back again. Somebody that has very severe ME can still have improved quality of life. And by giving them control over when they do something or how it's done, gives them more joy, more purpose, more meaning in their activities. So just looking at the time, the physical piece, and I'm going to break it down very briefly, the environment, and then the adaptations and modifications. So just briefly, I won't go through all of this. This is just examples for somebody that has severe ME. Body washing. Is it every other day? Is it every other week? Is it one body part at a time? And when during the day is their optimal point? Looking at the physical piece, the environment, light, sounds, vision, smell, and then the adaptations and modifications, using unscented soaps, using towels instead of having to get dressed right away. So this is just an example for body washing. And then in an article that I was co-writing with Jose Montoya, Mary Deming, and a whole group of others, we wrote about caring for an individual with severe ME. And these are just some very basic outlines of what you can do for modifications and adaptations. And then I just wrote down, I brainstormed just what it might look like for bathing for a person with moderate ME, using that same framework. Just looking at what the physical events, what are they going to use, a shower chair or use just the bathtub for positioning, putting your feet up in reclined position as much as you can, just to give the body as much blood and circulation and controlling autonomics as possible. And then again, here's some modifications and adaptations, just to get some ideas of how to start giving individuals a little bit more support in their life. And then we can get into this later with pacing for PEM. This is pretty much what I just talked about. What are your symptoms? What are your priority lists? What are you going to do with your tasks that make it meaningful and purposeful for your life? And then looking at time, physical, environment, and then the modifications. And here's just a spreadsheet for you for reference. All of my notes, all of my slides are going to be provided on the Solve ME site. So don't worry about having to take screenshots or anything, but you can have access to this. And then I also have a website you can look at to see if you have any more questions. You can reach out to me directly at otforme.com. Thank you.
Thank you so much, Amy. It's this so helpful. And again, those slides will be available for download on either the Solve ME website, or you can view this recording on YouTube to go back and review that section again. And last but most certainly not least, Dr. Sharon Stevenson, I'm so pleased to bring you to the conversation and share some of your insights about how managing with energy limiting disabilities can affect your personal life.
Okay, thank you. I've always sort of said I'm overeducated for anything actually useful, but I think since with the Caring Info website, I'm actually feeling like that may in fact be useful. Just a little bit about where I'm coming from. Most of my background is in caregiving. At this point, I have a husband with advanced Alzheimer's disease. I've been caring for him for 10 years and with an indefinite, horizon going forward. So Caring Info came about. I conceptualized the US healthcare system as an incredibly unfriendly cafeteria. You have to eat, but no one in that cafeteria is going to tell you what's in the food. They're not going to tell you how much it costs. No one's going to help you with your tray, but yet you still have to navigate it. And so we wanted to put together the best kind of information we could to allow people to be as empowered as they can be based on information to deal with the healthcare system. This is going to be a bit of confetti. One of the speakers talked a fair amount about Medicaid. Just to remind you, Medicaid, while it's a federal program, it's administered at the state level. And so you will need to understand what is offered in your state, and that varies greatly. Now, we have a whole long page. I'll quit advertising caringinfo.org, but we have a whole huge kind of section on Medicaid and people that will help you apply for it and that kind of thing, and links to the various states' offices. Another thing I want to talk about is having someone or someones that may be able to speak for you when it's being difficult for you to speak for yourself. Now, that could be, a patient advocate, but it can be a friend. And the advantage of having a healthcare durable power of attorney for that person, so they can speak on your behalf. And I say durable in the sense that there's two kinds. There's springing and there's durable. Springing requires you to have a letter from a physician or a healthcare professional saying that you are unable to speak on your own behalf, which is an extra step and that makes it much more difficult to use. Obviously, the durable allows the person to speak for you. They never have the authority to speak for you as long as you are able to speak for yourself. But it does help in dealing with the healthcare system and getting people to talk to your agent or the person that might be helping you out. The other thing, we come at this also from a caregiving standpoint. And of course, I was thinking about it when I was listening to everybody else. I mean, all of the sort of categories of caregiving are exactly the same, whether you're doing it for someone else or you're doing it for yourself. And I found it interesting in putting this information together for the website. There's a structure, if you will, of what the tasks are of caregiving, not specifically in the sense that Allison was just doing, but categories of personal, meaning direct caregiving, changing bandages, helping do grooming. There's the physical environment, which is washing the sheets, buying food, keeping the house clean. Interestingly enough, there's a whole category about nurturing community and connections. And I mean, I, for instance, communicate with my husband's children on his behalf, and that takes time. And then administrative, the ever popular, dealing with the healthcare system, with insurance companies, with PBMs and the like. Financial, which is very big and takes a huge amount of time. And then lastly, and completely not least, self-care. And I found that to be a very useful construct because honestly, I wasn't counting the administrative stuff or the financial stuff as actually being part of caregiving. It was just something that needed to be done. And it helped me understand the amount of time I was spending. And it kind of speaks to some of the other speakers when they talk about there's this whole huge list of stuff to do. And, how do you prioritize what's important? I also think it's useful, as I'm sure we have all experienced, kind of everybody has a point of view and everybody can tell you what would be good for you or tell you what you need. And I found it useful to develop a script. So when someone is offering unsolicited advice, I actually have kind of a go-to, thank you very much. I really appreciate your interest, kind of moving right along. And it really did help to have kind of a list of 2 or 3 things that I might turn to say, as opposed to standing there, with your eyes large and inhaling and kind of like, oh, I can't believe they just said that. The other thing is, and I know you're probably all doing this, but organize, 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 and simplify, simplify, simplify. I mean, one of the best things ever is auto pay if you happen to have electronic banking, because then you don't have to worry about is it the 15th of the month or not. There's a lot of software out there and some apps that are incredibly useful in just eliminating, some of the time that needs to be spent. And I guess lastly, I'd just like to talk about, the small pleasures, finding time and space just to be. And that is incredibly true, whether you're the patient or the person that's receiving care or the person that's giving care. It is really easy, really, really easy to lose your identity and your sense of self in all of this activity and keeping track of all of these things and dealing with all of these people. And I mean, the healthcare system is just brutal. And to find, whether it's the cup of coffee in the morning, whatever it is that speaks to you and your sense of yourself, to make sure that's fairly high on the list of things you give some priority to, and let perhaps some other things go. So I'm short of time, but that's my immediate wisdom, so to speak.
Thank you so much. And that is some excellent wisdom. And I've definitely used caringinfo.org for my caregiving journey, and it is incredibly valuable. So I highly encourage folks to take a look.